There she is. Isabel's here.
Is Isabel already in?
Yes, I'm here.
Is she? Okay, great.
Welcome. We can see our attendees are starting to join us. We're going to wait a couple minutes till everybody has a chance to get on the Zoom webinar, and then we'll get going.
Hi, Ashley. Hi, Lori. Hi, Melanie.
Hi, Isabel. Thanks for being here.
I'm nervous, but I'm here.
You got it, Isabel.
I know. I'm
You
trying.
got it. All right. Just another minute or 30 seconds, and then we'll just dive right in. All right, well, it is 3 o'clock, and we are so appreciative of all of the attendees who are joining us today and our panelists and our group here. My name is Melanie Dodson. I'm the Executive Director of the Community Child Care Council, better known to our community as 4Cs. We are the local state-funded child care resource and referral agency, and it's with that hat that we're bringing you this forum today to talk about child care and talk about what's happened during COVID, and to really bring you the stories of our providers and some data to share with you about what's going on in our community around child care. So today I am joined with some important folks. First of all, my colleagues at 4Cs who helped coordinate our event today. Ashley Chavez, who is our 4Cs Quality Counts Program Director. Lori Siebler, who's the Director of our Child Care Resource and Referral Department team. Also, Irma Zavala with 4Cs is here to assist for some translation later. Thank you, Irma. She's also with our R&R team. And then we have our fabulous panelists. Our panelists include Corey Pabros, who's the site supervisor of 4Cs Right Start Preschool. Michelle Head, who's our Chief Operations Officer of the Sonoma County YMCA. Nicole Monticello, who's the owner director for Storybook Village Preschool. And Isabel Menivar, who is a wonderful licensed family child care provider here in our community. And also Renee Whitlock Hemsavon, who's the owner director of Community Preschools, Inc. She's also our current co-chair of the Child Care Planning Council of Sonoma County. So a huge thank you to you all for being here. So I'd also like to take a moment to thank all of our participants and attendees who are here today. I know that many of you are representatives from our state assembly, our Senate offices, our local elected officials from different cities and towns in Sonoma County, business leaders, and our very important community partners. So thank you for being here today to educate yourself around our community, for what's going to go on with our economy regarding childcare, and of course for our families. It'll truly take partnership and advocacy at both local and the state level to ensure that our childcare industry has the resources and support it needs to survive COVID. So I'm super grateful for you all being here today. Let me talk through a little bit about the structure of our webinar. So I'm going to start with 4C's data around the status of childcare in Sonoma County. Then I'm going to turn it over to each of our center and childcare provider representatives, and they're going to talk to you a little bit about what's going on for them, what it's been like to serve children and run their programs during COVID here in Sonoma County. If you have questions while we go along, please use the chat feature and go ahead and put your questions right in there. We will get to questions at the very end. Of course, at the end too, when we're doing our Q&A session, if you also would like to ask your question live, that is fine too. And Ashley will help us facilitate that after all those quick presentations. So let's kick it off with some data, and I am going to share my screen here. All right. To give you a little bit of insight into data in Sonoma County. So we have done this presentation a few times and we update it regularly. So this data is hot off the presses, December data. And of course, now it's not moving forward. Let's see. There we go. All right, I'm hoping you can all see that. So in Sonoma County, this is a slide that is showing you how many facilities are literally open in our community. You can see the orange there in the chart is our pre-COVID back in March or January, February, March of this year. We had 284 facilities that were childcare centers. That's both infant, toddler, preschool, and school age. And we had 324 licensed family childcare providers supporting our community. Today, we have 134 centers that have been able to stay open and 258 family childcare providers. So you can see just by the visual, the drastic reduction in numbers that are available to our parents, to our working parents here in the community. We unfortunately know that permanently we have lost 5 center-based programs and 34 licensed family childcare providers have permanently closed due to COVID. The little bright spot is that 4Cs has been training new licensed family childcare providers. And since March, we have also been able to train and help support to open 46 new additional licensed family childcare homes. So there's a little bright spot there. But as you can see, we're going to need to do work to sustain our capacity going forward as we all become vaccinated and we move through COVID. And this is just another way for you to visualize, to see the big drop. Both family childcare and centers, you can see what happened in March when the shelter-in-place order was coordinated, and all of a sudden everybody closed, and then as just kind of slowly crept back up a little bit as we've come towards here in December. Here is the big drastic change to really see. So yes, those were the facilities we were talking about, but here's what it amounts to in actual childcare spaces here in Sonoma County. So we have lost 61% of our slots since March. And that's even adding back in the few that have now become new licensed programs. And then at the same time of losing all those slots, and right now our childcare capacity in our programs is greatly reduced at the same time. So instead of a site that used to serve 48 students in several different classrooms, we're only allowed to serve 12 students in each classroom. So that has exacerbated the problem of not having enough slots to serve our community. At the same time, we have 4Cs houses a waiting list, eligibility list for families who are needing support to pay for childcare. And you can see right here, we have not seen a big growth or decline in people on that list. We've seen a little bit of decrease, but that does tend to come because we do some cleanup to see who still needs services. But we have about 1,493 children that are still waiting for spaces and waiting for subsidized support to pay for those slots that they are looking for. And this includes children birth to 12 years old. So this is just some kind of big picture information for you all around what's going on in childcare programs right now. So who can attend childcare during COVID? Anyone who needs at this point. We don't know what the governor's new shelter-in-place directions may be, but currently this is what we are operating under. The state-funded programs are prioritizing all working families. Our group size per public health is a maximum of 16 children, or not children, 16 individuals, and that has to be children and the teachers. So if you have a full day program and you're serving 12 students, you have about 4 teachers who are splitting the shifts during the day to make it a full 10.5 to 11-hour day for childcare. We have to have separate and stable groups of those 16. We can't bring in new teachers or different teachers to the best of our ability. We have daily health screenings, temperature checks, social distancing as possible, huge sanitization requirements, and of course, individualizing materials in the programs. Masks, we have requirements for masks, no, but not for children under 2, of course, because it's not safe. And then we're encouraging our children to wear them as much as possible. And then our job is to contact public health if we know of any of exposures or positive cases. And then we work with public health to determine how our sites will stay open or close as needed. So that is kind of just an overall summary to kind of tell you how dire it is in childcare. We're missing lots of programs, we're missing lots of slots, and our very small businesses, these are all small businesses across Sonoma County, are truly struggling to stay in business right now at about 45% of their normal capacity. So if you think of we know many industries are struggling, and childcare is one of those for sure that we need to continue to consider and plan for, particularly as the economy works towards reopening and people go back to work. We will need places for more children to be able to go, and we don't want to lose this capacity. So I'm going to take a few moments and share with you a few of the things that 4Cs has done before we hear from our panelists. So since March, 4Cs has worked to truly uplift and sustain our childcare community in these difficult times. Our childcare providers are our unsung heroes who in the face of a pandemic have stepped forward, putting themselves at risk each day to provide nurturing care and education to children whose families must go to work and have adapted their programs to support their enrolled children with distance learning because our schools have remained closed. The Sonoma County childcare providers who have been able to remain open have changed their protocols, implemented endless public health mitigation efforts, and have shown up to work every day to keep the economic engine of our community going. Childcare is an essential service. 4C's COVID response, in addition to our ongoing everyday work, has included things such as, right off the bat in March, we were consulting with the Sonoma County Emergency Operations Center to ensure that all healthcare providers had access to childcare when the first shelter in place was announced. We've facilitated local and state funding to pay essential worker childcare for an additional 388 children that has now been extended through March 2021. We've distributed PPE equipment to all open childcare facilities, things like sanitizers, gloves, masks, even diapers, to ensure that our childcare providers had these at their disposal. We've provided regular updates, training, and support to assist the community to navigate local and state health requirements, partnering with community care licensing, public health, and state COVID requirements. Especially at the beginning, it was very confusing times for our industry, as it was for many. So 4Cs really played a role in helping our providers to understand what was now required of them. 4Cs distributed state funds to childcare providers that were open during the pandemic to offset their increased costs in June and July. We've advocated for additional local and state resources, such as the Child Care Resiliency Fund, and we've continued payments for all of our state-funded programs and the voucher dollars for voucher recipients. 4Cs pays over $1 million per month to child care providers for the care that they're providing to the children in their care. We've provided trauma-informed care and ongoing training and support, including one-on-one coaching to providers to support them during these times, as well as providing and supporting our providers to get access to mental health for themselves, their staff, and the students that they're serving. We've educated and continue to educate our local employers and community partners on how to create distance learning programs and how to set up pop-up childcare. We've continued to tell the story, like we're doing today, of the impact the pandemic has had on the childcare community. We've recruited, as we noted, 46 brand new licensed family childcare providers, and we will be continuing to distribute additional funds this month to providers who have been serving children who are recipients of the child care vouchers. So we'll get some additional funds out to them. The child care industry has been in crisis mode for a long time now, between wildfires, smoke, power shutoffs, and now the pandemic. All are exacerbating an incredibly under-resourced industry. Teachers have been let go, programs that are operating are running at very thin margins, 45% of capacity, and we just don't know how much longer they can sustain. Childcare, as you know, is a critical part of our economy. It allows parents to work while their children are in caring, safe, and educational environments. And it employs thousands of people across the county. So as you listen to providers for the next half hour or so, I invite you to join us in advocacy opportunities and becoming a voice for increased public funding for local, state, and federal resources that become invested in our childcare industry and working towards especially essential teachers' wages and supporting these programs to sustain. So after this overview, I'm now going to turn it over to our panelists. Up first, I'm going to invite Corey Pabros, the site supervisor of 4C's Right Start Preschool, to share with you about her program. And I'm going to now stop sharing my screen.
Thank you, Melanie. So my name is Corey Pabros, and as Melanie said, I am the site supervisor for 4C's Right Start Preschool. 4C's has 12 preschools in Sonoma County, and we opened this preschool 4 years ago. So I've been the site supervisor here for the last 4 years. We're going into our 4th year. Pre-pandemic, I had 70 students. I had 3 classrooms, a full day program that ran 7 to 5:30, and then 2 part-day programs. One of my part-day programs is an inclusion classroom that we partnership with the Right School District here in Santa Rosa, and they include all of their children with IEPs, individual education plans. That classroom is closed. My other part-day classroom is closed, and my full-day classroom is open. So right now I can serve 12 students in person. And I also have distance learners that are enrolled in my part-day programs. We serve, at my preschool, we serve 3 to 5-year-olds. Most of our students are dual language learners. Like I mentioned, I have students with IEPs. I put together a little very short video for you guys to kind of show some of the things we've had to modify, how we've had to change our program since the pandemic began. So I am going to share my screen and share. And these are my students, some of them. Let's see if we can get this going. So of course we're wearing masks. That's number one. First thing, we had to start wearing masks. We do health check-ins. We take temperatures of the students, we take our temperatures of our teachers, and we ask health questions to see if anybody at home is sick, if anybody's been exposed. We've recreated our program with individualizing everything. Students are not sharing anymore. They're not touching each other's toys, or that's our goal. So we've made individual activities, and these guys are, we're teaching them to not share, which is very strange when all we've ever taught our students is to share. And we have closed our water fountains for health and safety reasons. The children have their own individual water bottles that we clean and sanitize, and they stay at school. One of our goals is to not send things back and forth for health reasons. We have also completely changed our program into an outdoor program. We pretty much do everything outside. Sorry, my screen jumped. Catch back up. So outside we are doing art, we're doing PE, we're doing lunch, breakfast, and snack. The only time that we are inside is pretty much for nap. We have fun outside. One thing that I've noticed since the pandemic is the extra stress on families and on teachers. So we've really bumped up our social emotional curriculum. Students are wearing masks all the time. So we are trying to put up more pictures of them without their masks in the classroom. We are teaching about feelings, emotions. We've always done that, but we are bumping it up tenfold, because what I've noticed most during this pandemic is the stress that it is causing my families and my teachers. My teachers are, they have their own children, they have their own families to worry about at home, but they're still coming to work and showing up and being there for our students so parents can go to work. Also, a change has been the sanitation. We pretty much have one teacher dedicated to cleaning and sanitizing all day long. I'm gonna stop sharing. Back in here. So I guess the biggest thing for our program has been the stress of coming to work during this very, very, very stressful time. I had one teacher this week. She is a single mom. She has 4 kids. Her baby goes to a daycare. One of the students in the daycare tested positive this week. So now she's home. She's stressed out that her baby's going to have COVID. She's stressed out that she exposed all her teachers. She's told me several times, like, I'm really scared now that I, brought COVID to our school, that we could give it to our students. And there's a lot of stress around catching it and giving it to each other. One positive I've noticed in this pandemic, one silver lining, is that the early childhood community has really come together. I have met more directors than ever before. Nicole, who's on this panel, she has great ideas and is always posting on our director Facebook page, and we share and support, and that has really been a silver lining. Thank you. Thank you.
Thank you, Corey. It's good to see what it looks like in the programs. Thank you for sharing the video. All right, up next is Michelle Head with the YMCA.
Hi, thank you so much for coordinating this wonderful opportunity in this forum to be able to speak on behalf of the Y. And I'm really honored. I started my career working on the front line in childcare, and have just had the wonderful opportunity to work for the Y for over 28 years. And although I don't work on the front line directly with children anymore, it's very near and dear to my heart. And so I'm honored to be able to speak on behalf of all of our childcare workers today, and to kind of give a little bit more of an overview of what the Y has been experiencing in our programs, and just as an organization, which is similar to what everyone else is experiencing as well. So the Y has been providing services in Sonoma County for over 65 years. And traditionally, we bring people together in our physical spaces. And I'm sorry, it's like after 9 months, I still just get so emotional when I think about what we've all experienced these last 9 months, and what's still ahead for us. And but I think there's also a lot of bright spots. So I look forward to sharing what some of those bright spots have been. So, I think in the face of COVID, we had to quickly pivot and make some decisions about operations, and, what were the things that we could continue to do to serve our community, and, what were the critical needs in our community. And so I think it forced us to kind of look at things a little differently. And so the Y, over the last 9 months, not only have we been providing distance learning, we started out providing essential care all the way back in March. I think we only really were completely closed for a couple weeks before we were able to quickly ramp back up and train our staff and get everything in place to provide essential care for healthcare workers and essential workers. But for the Y is more than just childcare. We also provide healthy living opportunities and social responsibility opportunities. So some of the other things that we've been doing is we've provide showers for those who are experiencing homelessness in our community. And we've also continued to be able to provide virtual and outdoor wellness offerings to try to minimize isolation for people and keep people connected and active as we all move through this challenging time. I think some of the other challenges have been to have to face laying staff off. That's probably been one of the hardest things I've had to do in my 28 years here at the Y. And we laid off 150 employees. Fortunately, we received the PPP funding, and so we were able to pay our employees with that funding, and because we were financially sound at the time through July, but at that time we just couldn't continue to do that. And it really became a decision of we need to not just think about the now, but we need to think about the future of our organization and what we're able to provide for the community as we move forward. So we hope that, we know we'll see brighter days ahead, and we hope that we'll be able to, have our wonderful Y staff come back to us at that time. I think through this whole experience, it's really been like starting a new business. In one way, I'm grateful that our county has not had to pinball back and forth from tier to tier, that we've kind of stayed in that highest tier, because it's been challenging to try to retrain staff, get all the COVID protocols in place, ensure that we're holding it up to the highest safety standards, as well as educating our families and the children on all the protocols and what needs to happen. And the expense of all of that, the expense of investing in all the, we've invested in electrostatic sprayers and the UV ray wands to give to all of our sites, and all those things, they come at a cost. So that's been a challenge. But grateful, as Melanie, I think, said, our staff are our unsung heroes, and they really are. They're the ones that are the face of our organization, and they're the ones that are interacting and out there every day, providing an enriching opportunity for our children. And so we provided essential care, and then we provided summer camp, and then we pivoted and provided distance learning as the school year ramped up. And we're only operating at about a 25% capacity. We normally would serve about 1,500 kids a day. We're serving about 380 kids a day. So I think one thing that we're grateful for is that we have the facilities to be able to spread our kids out. We provide care on school campuses. And so we've had this opportunity where we have these portables that the Y owns on these campuses. And so we've been able to utilize those portables and, keep the small groups. We're doing pods of 12 still at our various locations. And really grateful for the school districts that we work with. They've really been wonderful in accommodating our needs and working with us and giving us additional classroom space at no cost. So that's been, I feel like from day one, they've really been open to the conversation and wanting to be our partner, and making sure that we can serve their families and the kids who need the care. Let's see. I think that, so we provide full-time and part-time care for families. And although we're serving 25% capacity, we have the same number of families who need financial assistance as they did when we were serving 1,500 kids. And so, as we all know, the need is just growing, and it's just so great. And so I think that there needs to be a real look at continued funding, increased funding to support all of our childcare centers, so that they aren't just here for the now, so that they're here for the future of our community. And I just can't speak to that enough. And also, I think funding, when we think about the learning gap, I think that there's going to be this incredible learning gap that's going to happen. We probably haven't really even seen it. And I think kids that were struggling before are even going to be struggling more now. And so I think that there's an opportunity to look at what resources can be allocated to that. And so grateful to to our teachers who are doing what they're doing, and then our own staff who are supporting the distance learning opportunities for our families and our kids. And so I just thank you for this, putting this forum together, and for everyone who's on and listening and hearing our thoughts.
Thank you, Michelle. So now we're going to pivot. Both Michelle and Corey really represent larger organizations that umbrella multi-sites. Nicole Monticello, who is the owner director for Storybook Village, has her very own business, and she'll tell us about that. Hi, Nicole.
Hi, I found the button. Thank you for having me. I'm Nicole Monticello, and I'm the owner and director of Storybook Village Preschool. We're located in Santa Rosa. We provide year-round care and education for infants, toddlers, and preschoolers. We have an infant license with a toddler component now and a preschool license. So on slide 2, we are serving infants as young as 6 weeks to children entering kindergarten. The school was full before COVID. We had to change our capacity, and we're full for the capacity we're allowed to have now. And so we're meeting the needs of working families in Sonoma County. We work with families who are parent pays and subsidy pays from the county and state. So being all inclusive, not just with developmental abilities, but with addressing the social economics gap was incredibly important to me when I opened the school and designed the business structure in April 2019. So we're still kind of fairly new. We live, I guess what I needed to start off with, we were already in a childcare crisis before the pandemic hit us. So we were already aware of the need of providing a healing environment for the children and being there for all families. And the culture we created was really sweet with our relationships and just the supports we gave them, and working with teaching pyramid for families, with early learning institute, just all the resources we had. And then we were hit by COVID. So the next slide. Yeah. So I have pictures because I love sharing their smiles. So the next slide, this slide, we basically decided to stay open the entire time. So our preschool has stayed open for essential workers, and we stayed connected to our preschool community. So we did distance learning for families who couldn't use care at the time. The children and families need us more than ever now to be physically and emotionally safe while balancing pandemic parenting, which is really hard for our families. Deciding to remain open was the hardest decision as an educator. It's a lot of pressure to keep a community safe and healthy. And then as a business owner, and a new business owner, supporting our teachers, and my goal was to keep them employed because they have families and the morale. And then I wanted to keep the promise to the children that they would return to people who they love and trust. We had 14 teachers on payroll, so that was a big decision. Not to mention I'm a single mom, and as a new business owner, if I closed the school, we would have been closed permanently. There was no way to recover, and I knew that after staying up all night. So we stayed open. We decided to adapt, and we're on slide 4, the next slide, sorry. Thanks, Ashley. Okay, so we decided to adapt and change our program overnight. We changed the structure, policies, procedures, basically everything that was shared from Melanie and Corey. We've been implementing the same safe practices. We consider ourselves experts in keeping children healthy since we have a healthy preschool. So when the health orders and the pressures for implementing the county and state requirements were handed to us, we weren't intimidated. I think the part that was really hard for me was the fear of the unknown and the financial stress. That's been pretty unbearable. So the next slide shows how we've been focusing on relationships and more than the health piece, but we're trying to work and figure out how can we stay connected to families, and how do we make sure we can provide children a healing environment while families' needs are changing, or our program's changing and can't meet the family's needs. How do we go from a preschool to essential business without government support? So the next slide These are the significant changes we made to meet pandemic regulations. I have revised the pandemic handbook 14 times since March, and I expect to do so again within the next couple days when our governor makes more changes. We've been really great with change and change management and keeping it about the children. On the next slide. Sorry if I'm speaking so fast. It's just 7 minutes to share our experience of 9 months is a lot. So I just kind of am trying to highlight the main pieces. So right here, like everyone, I never planned or could have prepared for a pandemic. So implementing our policies was more challenging than I could have imagined. The overhead doesn't change since I always pay teachers for closure days. And as a newer program, we have been hit with every natural disaster you could think of in California. So, and then balancing a couple of natural disasters during this pandemic has been hard. So it's been heartbreaking. Well, it was heartbreaking when my insurance agent told me that we weren't covered by a health outbreak. So my concern is the aftermath, the children who couldn't continue, the families who couldn't afford care. I have families asking to return and I can't say yes because our capacity decreased or we have a waiting list. And it's very emotional, this business, because you're dealing with relationships. So the kids don't understand why they can't return to their school. So on the next slide, the child care's closing or teacher turnover is a vicious cycle, and the pandemic has been bittersweet, bringing the light in the for the need for change and continuing upstream investments and understanding that we have major problems here, but we have so many solutions, and all the programs operating around right now during the pandemic is proof that it's possible. It's possible to improve and do better. So the next slide, we did get the PPP. It covered 2 months of payroll, and someone said, okay, so it covered 2 months of payroll. So it allowed me to buy some time. It helped bridge the gap of, we lost about 15,000 a month with this pandemic. And my concerns are like the post-pandemic and recovering since I rent the building. So if our lease is up in 3 years, and the savings that I've been able to save little by little as a new business was a down payment, how do I secure our business if the owner wants his building back? So these are, not only am I worried about the moment, I'm worried about the aftermath in post-pandemic. But there have been so many successes, which is why we've been able to stay open and healthy. We haven't had any scares, and I need to knock on wood. We've had a couple scares, but we haven't had any confirmed cases. So being a quality counts participant with 4 Cs and receiving the grants and the PPE supplies, it's helped us tremendously. And the power of community, it's shown us what that's worth right now, experiencing all this. And the next slide, what I noticed about the impact on the families I serve, but children are handling this way better than us adults. And I can't speak for the parents, but they did share their thoughts, and they did help us kind of understand what their needs are. So there's not much room for flexibility because the health orders are pretty strict, and that's been the hardest part about my job is my role changed and our relationships changed, and I couldn't say yes as much as I was used to. I couldn't find solutions. It was really hard. It changed all our relationships. And on the next slide, we are only getting through this pandemic because of the families and teachers working together to do what is needed to stop the spread. We have an incredible team of teachers, and they're dedicated, and they show up every day, and they keep on showing up. And without them, we would not be open. So I checked in with all of them, and they have good days, they have hard days, but they definitely are our heroes. And I know that's a redundant comment and thought, but there's no better way to explain it. on our last slide, I believe we're on our last slide. And I don't know if you've held up the number sign because I can't really, oh.
Your time is, but do your last
Okay,
slide.
so
and then
this is
we'll
just
go.
saying, goodbye and thank you. And that's it.
Thank you, Nicole. I know it really is hard to tell the story of what we've all been through in such a short time, and I appreciate you squeezing it in. And then, so I think the opportunity here too, though, is to really have our community hear from a lot of us about what's going on in our different styles of programs. So that's really great to hear what you're doing, and as a brand new business, how you're working so hard to sustain. I'm seeing notes from Isabel that she can't hear us, but Isabel Menjivar, if we can figure out how to get her to hear us, she's next. Isabel is our wonderful licensed family child care provider. So she's doing care out of her home. And
at least get the screen loaded just in case one of us needs to go through it or something for her.
we could also go to Renee and then try to come back to Isabel.
I think so, until we can figure it out.
Okay.
Okay.
All right. Thank you for problem solving with us. All right. So Renee, we'll go to Renee. Renee, again, is the owner director of Child Family Community Preschools, and she also has a long experience with disasters here in Sonoma County. Renee.
Hi, everyone. Thank you for being here this afternoon. And I wanted to kind of go over an overview of what our community has been going through for essentially the last 5 years. I want to do an overview kind of in general, and I will speak to what our program is going through as well. So I believe that COVID is kind of the straw that broke the industry's back in Sonoma County. It has been challenging for many of us. However, the challenges have been exponentially increased because we're coming on the heels of 5 years of natural disasters and things that have really impacted our ability to run our programs and our parents' ability to feel like they have a strong foundation in their world and in their schools for their children. So I would like to start with in 2016. 2016, we had the Valley Fire in Lake County. And for Sonoma County, the implications of that were that we definitely had a lot of concerns with air quality. Although we had wildfires before, it was really the first time that we really started talking about the impact of the wildfires on children and our ability to operate, be indoors and outdoors, and what that looks like for us. I don't believe we had closures at that time, but I do believe that year and the year prior during the summer, we did have some rolling blackouts that created some challenges with remaining open for many of us. And then 2017 came along, and that was the Tubbs Fire. So the Tubbs Fire in Sonoma County was really devastating for many families and programs. Fortunately, most of our programs survived and made it through that time, but a good amount of our programs, all of our programs were significantly impacted, and a few, including mine, was burned down in that fire. That was Mark West Community Preschool, and we served 60 families there. We were unable to rebuild because the cost of real estate and the cost of building in Sonoma County is cost prohibitive for a child care program to do that. Most of us run on margins, whether we are for-profit or not. We're looking at about 60 to 80% payroll, and the remainder of the fees are going to pay rent, utilities, and supplies. And there is very, very little margin for raises for staff and for improvement of facilities there. The additional implication that the Tubbs Fire had that is not necessarily as spoken about is it decimated the middle class working families in our community. It took out Fountain Grove, it took out Larkfield and Wickiup, and it took out Coffee Park. And what that meant for my programs, I have 3 in the area, is that for several months after the fire, many families had moved out of the area and they continued to move. And so our customer base had changed significantly for those of us that were trying to run programs on parent fees. Now, in addition to the Tubbs fire, after that, we were dealing with air quality concerns and closures there. And then along comes the power safety shutoffs. And what does that mean? So we had to deal with that. That was 2018. And then the camp fire happened. And all along, keep in mind the air quality concerns and the power shutoffs. And every time that happens, we always, even if we are maintaining our revenue, we do make concessions for parents across the board. Parents have to stay home. They may or may not pay their tuition. Many cannot do that. So that creates a challenge that is rolling over from year to year, that we are continuing to carry the financial burden or the financial losses from up to 5 years ago into now. 2019 came, we had the Kincaid fire and the massive evacuation, and we had the floods in Sebastopol, again, additional PSPS, and then this year we had COVID. So what that means for many of our programs is if we were hanging on by a shoestring, trying to hopefully get past to recovery, we never did get to recovery before COVID happened. My programs, because Mark West Community Preschool was not rebuilt, we were able and very fortunate to enter into a wonderful partnership with the city of Santa Rosa, and we did a remodel on a building. And then we moved in there as a replacement site for our Fulton site. And 4 days later, we got the stay-at-home order and had to close. Wonderfully, the city of Santa Rosa supported us in deferring our rent, which we still owe, but it is deferred during that closure period. And we immediately laid off our teachers to go to unemployment. The reason that we did that was because we knew from the Tubbs fire that the future was unknown and they needed to be able to get support immediately. By making that call, that actually allowed our educators to get in the front of the line for unemployment, and it helped for them to be supported. We did reopen in July, and we have been operating at 50% capacity as of September. It is going very well. However, we're operating at 50% capacity with the same expenses and the same staffing, and increased staffing costs and increased supply costs based upon the cleaning supplies and those things. So I will say, as a program as a whole, in our 3 centers, pre-COVID, we were operating at, we had 125 spaces, and currently we have 66. So we are operating at about 50% capacity. But our revenue from March 13th, when we first closed, when COVID hit, until now, is down 85%. We have lost over $500,000 in revenue. And because we do not operate on a profit, that is money that came directly from our local economy and is directly invested back into our local economy by paying our rents and paying our teachers, who then go and pay into our community. So I think that it's very important to realize that one of the biggest concerns that we have around this is going to be our infrastructure, our facilities cost. We live in a high cost county, and it is very challenging, as Nicole said, trying to purchase her building, really looking at the foundation of what this is a place for children to be. And currently, we can't even cover our expenses. So we're really looking in ways in which we can support the infrastructure and maintain healthy buildings for children. The reason I said to keep your note on air quality is our facilities need upgrades and maintenance to help with the health and safety of the children. Had we had air quality filtration and whatnot based on the wildfires, COVID would have been easier for us. So there's lots and lots more that has happened over the time and creates challenges for us. But I really just wanted to make a strong point to say that we are an industry in our community that is incredibly unique, that is coming off the heels of disaster into another one. And out of all, we definitely need support.
Thanks, Renee. Yeah, it's it's been a long haul for our small businesses. And we do have a lot of state resources here in our community, but they don't touch every single one of our programs. Many of them are small independent programs. They may take 1 or 2 voucher children, but much of their income is coming from our families, their tuition. And they, it's not like an industry where we can make more widgets to make more money. We have to charge tuition that parents can afford. So to stay in business, it's a challenging one for sure. All right, Isabel can hear us again. So now we'll turn over to Isabel, who's our licensed family childcare provider.
Yeah, thank you everybody for inviting to this meeting. I'm so sorry I lost my speakers, but I'm here again. My name is Isabel Menjivar, and I'm family childcare provider, and I'm working for 19 years with large quality childcare. I work with kids from 6 months to 5 years old, and I'm in that network and working with subsidized programs and private families. My first language is Spanish, and my staff and family is Hispanic, the more families, and speaks Spanish too. Sometimes I have a families with English language, and we support that too. My challenge is the same to the centers, and everybody talk to the same. Mandatory face masks all day for me and my kids. Parents don't come inside. Only one parent come and drop or pick up the kids, and need wait in the car until the parents leave. We remove the comfort areas and drama areas, a lot of toys for my kids. I put a small clip for that with pictures for my kids' masks. We remove the community sandbox, for the distance for my kids, and I put individual sensory tables. We purchase air cleaner filters too. And I purchased automatic faucets and soap dispensers. And I had to start caring for kids of school age sometimes for free, because the school is closed if the parents don't have any program or money for pay the daycare. And also the distance, the kids play more with distance. And I support these kids, the school age, and we need buy, the Wi-Fi range extenders for a stable internet, because sometimes the Wi-Fi is going and the kids lose the classes. In the adaptations, during the meals times, the kids don't serve anymore by themselves the food or fruit, vegetable. I use gloves to prepare and serve food. Most of the times the kids have a play independent, but sometimes, because it's a little kid, babies and toddlers need play together. It's only 2 or 3 max, and we need really support, same to the centers, in another programs. I will help a lot if the government can order the provider can have a priority to PPE for the providers. More pay like to hazard pay. The police department and the fire department have a hazard pay, because we are on the front. I never close. I work the whole pandemic any day if the parent need any time. To have a pay 6 days. We don't have a 6 day if we don't feel good. Grant is welcome, but it's better if it's not report like to the income, because it's for improved areas for the COVID. My success in April, I printed and laminate one COVID-19 book is from to the Snoopy Museum, and I use for my kids and learn visual how to protect themselves from the virus. And my challenge, I canceled 2 surgeries, one in April and one in May. It's for my leg, but I can't because I need continuous working for my families that work in medical field, food industry, and other essential service. I finish my day with 1 ibuprofen because I have my back pain, leg, everything. And in October, my shades outside is broken with the wings, the strong wings, and we don't have any more. And I working normal 10 to 12 hours a day. And also, I lost families. And start the year, I have my daycare is full and I have a waiting list. Now, I lost families because I lost the jobs in March. So I lost income and I had to let it go my assistants. The social distance is a big impact for my kids because cannot show emotions like to sadness or affection. It's really sad. If it's sad for any adult, it's more for the kids. It's hard to find the PPE and stay open for the follow the CDC rules. And I'm trying to talk with Costco's managers and 2 local members. I send different emails and never respond my request. I'm worried if we are following the rules requirements, and it's hard with the rules changing every day. Every day is different. In the news, I see more closures and more companies let it go many employers. My worry, and other people too, is to ground from my ability to stay open. In conclusion, I hope that Congress can see the importance of childcare providers. Also, to see essential workers will not be able to go work without childcare providers because we are open the whole pandemic time, but center is closed, school is closed, but we are front to the war. And it was difficult to PPE at first in the first month, and we really appreciate, the whole providers appreciate the support and help we receive to get from the agency. For example, Forces, oh my God, thank you so much, Forces, for everything. River to Coast, Children Family, and Fairfax, California too. It's really support for the providers, the center, school, I know working hard. In addition, I wish to have subsidized space available for working parents that cannot have a daycare because I have girls, I care sometimes for the parents, don't have any money, the parents, for pay the daycare, and I care free. And this is my petition for the state, for the Congress, for the people sign the big check for everybody.
Thank you, Isabel. Yeah, it's the work that you are all doing is so critical to supporting our families in Sonoma County. So I want to make sure we have a few minutes. We want to be respectful of everybody's time. We may go over just a little bit, so we understand if you can't stick with us. But we do want to give an opportunity for anyone who has questions for us about anything you heard from any of our providers or panelists before we kind of sign off here. So, Ashley.
Yes, go ahead and raise your hand. Sorry, the chat is blocking where I could see everybody. So use the feature to raise your hand. I don't see anybody calling in on the phone, so we don't have to worry about those codes. But if you are interested in making a comment or asking a question, raise your hand and I will unmute you. Not seeing anything yet. Or you can type it in the chat, of course, too.
While we're waiting, I can just share too. I do want to mention that I think Sonoma County, again, we are a unique, wonderful place that works well together. Childcare has been recognized here. The city of Santa Rosa, it's recognized as key infrastructure and as an economic driver. The city of Santa Rosa, the Community Foundation, and First Five have made local investments into a childcare resiliency fund that is currently available, which is supporting our childcare provider community with small grants. But really, they're a tip of the iceberg of what needs to be done. And I think it's fabulous that we've got this momentum. So now we need everyone's help to continue it. And I think we have so much work to do around recognizing the field and making sure that we understand that we can't just invest in it as it is. We need to make sure that our teachers are recognized for the work that they do and paid a living wage. We didn't say that earlier, but many of our teachers are barely making minimum wage. And they're doing some of the most important work. And when we talk about brain development for our children, that the 80% of our children's brains are developed by age 3 and 90 by age 4 before they enter the elementary school systems. It is in our childcare provider and our family childcare providers' homes where our children are. So we want to make sure that these are the most amazing programs and available programs. As you can see, we have dedicated folks here doing this work. And then the importance of the school age programs too, especially with our school community closed. This is not going to go away anytime quickly. And the more work we can do together to sustain this industry as we move forward, that is what we welcome you all to participate in going forward. We do know that the master plan was just released at the state level. And we are a complicated industry in the sense that we have both for-profit programs, Head Start federally funded programs, state-funded programs. So how do we weave these together and get all of these programs support? That is the challenge and the goal and the opportunity we have.
Thanks, Melanie. We do have a couple of questions. Cecilia Aguirre-Curry, I have allowed you to talk. There you go.
Hi, Cecilia.
Hi, this is Cecilia member. Thank you so much for the presentations. They're all very heartfelt. I just wanted to assure you that I belong to the Women's Caucus, and as being a mother and a grandmother, I understand the struggles that you have. And at one time I was going to be a child care provider back in the we won't talk about it. But the Women's Caucus is in tune with women's issues. Making sure that we have childcare is one of the #1 conversations that we have in the Women's Caucus. We continue to each year to do legislation. Sometimes it gets funded, sometimes it doesn't. But we just signed a letter this afternoon with Speaker Pelosi at the federal level, encouraging that we get childcare funding as well as paid family leave. So hopefully we'll see what happens after that. But again, it's really important that you contact your legislator. Congressman Thompson obviously is a good one, but there's others throughout the nation that you should probably tap into, because we need all votes on these things, and particularly in the Senate of those more conservative areas that may not approve the HEROES Act, is which we need to get that funding from. So again, thank you so much for the presentations. Remember, we're here for you. My office is always available if you have any questions, concerns, policy changes. I just want to thank you all. You're doing really incredible work. You're taking good care of our children, so thank you.
And we thank you, Assembly Member. We know the Women's Caucus, and you have been a champion for us ongoing. So I'm so glad you were here to hear from our fabulous providers what's going on locally, and so excited about the advocacy you're doing, and we will make those calls. Thank you.
Thank you.
Okay, there is a question from Jennifer O'Donnell, who asks, are there any local or state policies that we could support that would help childcare providers?
So many. I'm like going, okay, where do we go with that? Jennifer, great question. Renee might be able to help me on this too, and Lori. But I think some of the big things that we're talking about with facilities is how do we provide facilities as childcare? you know, cities making the designations, county making those designations so that it's not a huge expense to get programs up and running, so that it's a by right. Then also we really need to look at the one thing that the master plan brings forward is the potential for universal preschool. It is only 4-year-olds, but how do we create a funding source that supports all of our families who need to put their children in care and early education, birth through 4. So that's another area. Renee or
I could just add, I think that folks that are local really can do some local advocacy efforts. If you look at really what the city of Santa Rosa has done and the investment that they made with some of their CARES Act money and whatnot, I believe that's what it was. We would ask that you advocate on the county level. Let's ask the county to do the same. Let's ask the local cities to make the investment and use what's already existing and working currently, and go and ask and advocate for models like that, because that is the most effective way currently that our local providers can get support, is through funding that already exists in our community. And of course, it's not the solution, but it's definitely a bridge to get us to where we need to be. So I would ask, go to your county supervisors, go to your city council in whichever city that you live in or work in, and also any companies that you work for. Advocate with your company for family-friendly practices, for donations to organizations like 4Cs or the YMCA, for money that can be directly turned over to providers and to programs so that we can see an impact locally with our local dollars.
Yeah, building on that, I was going to say too, engaging our employers. If you think about our cities and our counties, particularly in Sonoma County, they are some of our largest employers along with our healthcare providers. So they need their employees to come to work every day, and many of their employees are parents. So we have a saying, parents earning while children are learning. So we need our employers to be involved as well. And what kind of benefit, childcare support and benefit can they provide to ensure, and to there's many benefits to the employer, of course, as well, as they are recruiting and have that as a benefit to offer. So, good question.
There have also been a couple questions about closures. So we had Diane Wicks asked, have some of the programs had to close because of COVID cases? And Jessica Wood has asked, what are the numbers of closed centers programs since the start of COVID?
Okay, so kind of two different questions, but let's see. So the permanently closed programs since March when COVID began, and most have closed because of the stress around keeping a business open during COVID. 5 childcare centers across Sonoma County have permanently closed, and 34 licensed family childcare programs have permanently closed. Currently, in addition to those closures, we have 155 centers that are inactive, meaning they're not open and not serving children right now, and 78 licensed family childcare providers who are also not open and not serving children right now. We don't know at this time that in a few months, as vaccines are introduced into the community, if they will reopen. The other question regarding exposures and numbers in childcare. Childcare, like any other industry, has absolutely had exposures and positive cases, and some programs have had to close. I believe I had numbers from October. We don't have current numbers, and let me see if I can find those quickly. But I believe it was about 3.5% of our providers have experienced a positive case associated to their program. So 3.5 of about 350 programs, 3.5%. So, and those cases, there was a Press Democrat article back in September about the spread, and we have had obviously cases again associated to the programs, but the numbers are very in line with other industries. Children are part of communities. Our community is experiencing a pandemic, so our industry is not untouched by this, of course, as well. But we don't have any we haven't had any huge situations where everyone in a center has tested positive, like you may be hearing with some of our more senior centers and housing and things like that. So.
I don't see any more questions at this time.
All right. Well, thank you so much. We're definitely at our time. Thank you for sticking with us a few extra minutes. Again, we'll be posting this online on Facebook. We're going to make this a YouTube video so that you can share it as with the folks who may not have been able to see it. Please help us share this information far and wide. And I just do want to assure you all 4Cs stands ready to continue as our central hub for childcare support for both our childcare provider community and our parents so they can access childcare in Sonoma County. And in order to sustain this field, as you've heard today, we all will definitely need partnership and assistance. And we look forward to working with you to make that happen for our community and for the economy going forward. Thanks so much for being with us today.